Welcome to Module 18, focusing on negative pressure wound therapy, also known as wound vac. This advanced wound care modality has revolutionized the management of complex wounds. Through the use of controlled, localized negative pressure, this therapy helps stimulate wound healing, reduce infection risks, and improve patient outcomes. Whether you're applying NPWT in a hospital, long-term care setting, or the patient's home, your knowledge and skill as a nurse are critical to ensuring success. Let's begin by exploring how this innovative therapy works and how it fits into a comprehensive wound care plan. By the end of this module, you will be able to 1. Describe the underlying scientific principles and the physiological effects of negative pressure wound therapy. 2. Identify appropriate clinical indications for its use, as well as situations where NPWT is contraindicated. 3. Demonstrate understanding of proper application techniques and be able to troubleshoot common issues. 4. Recognize and manage potential complications, such as bleeding, infection, or device malfunction. 5. Educate patients and caregivers to ensure NPWT is used correctly and safely in both inpatient and home care settings. This knowledge empowers nurses to confidently manage patients receiving NPWT and promote optimal healing outcomes. Negative pressure wound therapy, NPWT, is a mechanical wound management technique that applies controlled suction to a wound bed using a specialized dressing and vacuum system. It was introduced in the late 1990s and has since become a cornerstone therapy in chronic wound care, especially for deep wounds, surgical dehiscence, pressure ulcers, diabetic foot ulcers, and traumatic injuries. What makes NPWT effective is its ability to manage wound exudate, reduce bacterial burden, and promote faster granulation tissue formation. As frontline caregivers, nurses are instrumental in implementing this therapy, from preparing the wound and applying the dressing to monitoring healing progress and educating the patient and family. In this module, we will walk through every step of this process. Now let's take a closer look at how negative pressure wound therapy works at the tissue level. The mechanism involves both macro-strain and micro-strain, which together enhance wound healing. Macro-strain refers to the physical pulling of the wound edges together, effectively decreasing the wound size and depth. Microstrain occurs at the cellular level, stimulating fibroblast migration, endothelial cell proliferation, and the release of growth factors that promote tissue regeneration. Additional physiological effects include removal of excess exudate, which reduces the risk of maceration and bacterial growth, decreased edema, improving oxygen and nutrient delivery to the wound bed, stimulation of angiogenesis, promoting the growth of new capillaries, maintenance of a moist and sealed environment, which supports cell viability and protects against external contamination. This combination of mechanical and biological benefits makes NPWT a powerful tool in wound management. An NPWT system typically includes several key components. 1. A foam or gauze dressing that is carefully cut to fit the wound bed. This dressing distributes negative pressure evenly across the wound and serves as a scaffold for tissue growth. 2. A transparent adhesive drape that seals the dressing and creates an airtight environment. 3. Tubing that connects the dressing to a vacuum pump. This tubing allows the transfer of exudate into a canister and maintains the negative pressure. 4th, a negative pressure pump, which regulates the pressure and can be set to continuous or intermittent modes based on clinical need. 5. A collection canister where exudate and wound fluid are safely stored for disposal. Typical pressure settings range from -80 to -125 millimeters of mercury, but this may be adjusted depending on the wound type, patient tolerance, and healing phase. Understanding each component is essential for safe setup, consistent suction delivery, and efficient wound healing. A negative pressure wound therapy, or NPWT, is particularly useful for managing wounds that are large, complex, or healing at a delayed pace. It helps in optimizing the wound environment and accelerating recovery. Let's review the specific conditions where NPWT is commonly indicated. Stage 3 or Stage 4. Pressure injuries. These deep pressure ulcers benefit from NPWT because it promotes granulation and prevents infection. Diabetic foot ulcers. NPWT can reduce bacterial load and manage exudate, promoting better healing outcomes. Surgical dehiscence. When a surgical incision reopens, NPWT helps approximate wound edges and reduce healing time. Traumatic wounds. Deep lacerations or avulsion injuries can heal more effectively when treated with negative pressure to manage tissue damage and contamination. Skin grafts or flaps. NPWT secures grafts, reduces fluid buildup underneath, and enhances graft survival rates. Venous and arterial ulcers. It supports wound bed preparation and manages exudate and chronic vascular ulcers. Burn wounds and exposed bone. With proper protection and tissue coverage, NPWT can improve outcomes even in these difficult wound types. Each case should be clinically evaluated to confirm NPWT is suitable. While NPWT is widely beneficial, it's not appropriate for all wounds. It's essential to be aware of contraindications to avoid complications or harm. Presence of necrotic tissue or untreated infection. NPWT should not be applied over slough or eschar. The wound must be debrided first. Malignancy in the wound bed. Negative pressure may stimulate tumor growth and is generally contraindicated in malignant wounds. Exposed organs or blood vessels. Direct suction over these areas can cause catastrophic injury. Non-enteric fistulas. These abnormal tracts to the skin can worsen with negative pressure. Uncontrolled bleeding. Suction can increase blood loss if the source isn't controlled. Use caution with fragile or elderly skin, risk of skin tears and trauma from the adhesive. Ischemic wounds. If blood flow is not adequate, NPWT might further compromise tissue viability. As nurses, always perform a thorough wound and systemic assessment before starting NPWT. Maintaining a strict protocol for dressing changes is crucial for the success and safety of NPWT. Routine dressing interval. For most wounds, change the dressing every 48 to 72 hours. This allows time for healing while minimizing disruption. Infected or high exudate wounds. These may require more frequent changes, daily or as per provider's direction. Sterile or aseptic technique. Always follow institutional protocols to prevent contamination during dressing changes. Thorough documentation. Record wound size, depth, presence of granulation tissue, exudate type and amount, and any odor or signs of infection. Change the dressing immediately if there is active bleeding. The vacuum seal is compromised, air leaks. Tubing becomes blocked or the device alarms. Ensure patients understand that dressing changes may be uncomfortable and offer pain management when needed. Continuous monitoring of the wound and NPWT device is essential to ensure therapy is effective and safe. Nurses should observe and document. Wound healing. Progress, note reductions in wound dimensions, improved tissue quality, and decrease in exudate volume. Drainage characteristics. Look for changes in color, odor, or consistency. These could indicate infection or healing. Pain or discomfort. Sudden increase in pain during therapy may suggest complications like infection or vacuum pressure issues. Seal integrity. Even a small air leak can halt negative pressure, so the occlusive dressing must be checked regularly. Foam count and retention. Always count foam pieces during application and removal to prevent retention of foreign material in the wound. Canister volume. Drainage canisters should be emptied before reaching capacity and replaced as needed. Excess fluid buildup may indicate worsening infection or overproduction of exudate. Timely monitoring and response are crucial for NPWT success. The correct application of NPWT is both an art and a science. Here's a step-by-step outline for safe and effective setup. 1. Cleanse the wound. Use a prescribed solution to clean the wound bed and surrounding skin. Perform debridement if needed to remove non-viable tissue. 2. Apply foam or gauze. Cut the foam to fit the wound dimensions snugly, but without compressing the tissue. Avoid overpacking, as this may impair healing. 3. Secure with occlusive drape. Cover the entire foam and surrounding healthy skin with the adhesive drape, ensuring an airtight seal to maintain negative pressure. 4. Connect tubing to suction unit. Attach the tubing port to the foam and to the pump. Make sure the connections are tight and free of kinks. 5. Set the prescribed pressure. Common settings range from -80 to -125 millimeters of mercury, depending on the wound type and patient tolerance. 6. Start therapy and monitor. Activate the pump, observe for immediate contraction of the foam, and ensure there are no leaks. Always provide patient reassurance during this process, explain what to expect, and assess their comfort level after therapy begins. While NPWT is generally safe and effective, complications can arise, particularly if the system isn't used or monitored properly. Let's walk through some common complications and the appropriate nursing responses. Bleeding may occur, especially in wounds close to blood vessels. If you see active bleeding in the canister or dressing, stop the therapy immediately and notify the healthcare provider. Odor or systemic symptoms like fever could indicate infection. Don't ignore subtle signs. Assess the wound thoroughly, obtain cultures if needed, and escalate care. Seal leaks are a frequent problem. You might hear a hissing sound or see wrinkling in the dressing. Check all tubing connections, reinforce the drape, and reposition if necessary to maintain negative pressure. Foam adherence can damage new tissue if pulled out forcefully. If you encounter resistance during dressing removal, gently irrigate the area with saline to loosen the foam. Skin maceration around the wound edges may happen if exudate leaks under the dressing. Prevent this by applying a skin protectant barrier before sealing the drape. Patient anxiety, especially in home settings, is another concern. The device can be noisy or intimidating. Educate the patient, answer questions, and provide reassurance. Nursing vigilance is key to minimizing risks and maximizing therapeutic benefit. Proper education empowers patients and caregivers, particularly when NPWT continues outside of the hospital. Here are the core teaching points. Keep the device powered on and connected at all times. The system needs constant suction to function correctly. Avoid disconnecting or tampering with the tubing unless instructed by a clinician. Disruption in negative pressure can delay healing. Monitor for warning signs such as increased pain, foul-smelling drainage, warmth around the wound, or visible bleeding. Teach them when and how to report concerns. Responding to alarms is crucial. Most NPWT devices have alerts for leaks, blockages, or low power. Go over the basic troubleshooting steps with them. Practice proper hand hygiene before touching the dressing, tubing, or device. This reduces infection risk. Never cut or remove the foam dressing at home. Even if it appears minor, this should only be handled by trained professionals. Equipping patients with this knowledge not only reduces complications, but also boosts confidence in managing their wound care journey. Now, let's look at what research tells us about NPWT. Numerous clinical studies and meta-analyses support its effectiveness. Key outcomes include accelerated wound closure compared to traditional dressings. This means shorter healing time and reduced morbidity. Lower infection rates, especially in surgical or traumatic wounds, due to the controlled environment and removal of exudate. Improved skin graft, take and flap survival, making it a preferred option post-operatively in plastic and reconstructive procedures. In diabetic foot ulcers, NPWT has been shown to help avoid amputations and preserve limb function. Reduced hospital stay durations and lower reoperation rates, which translates to overall cost savings for healthcare systems. These evidence-based benefits highlight why NPWT is considered a gold standard in complex wound management. In summary, negative pressure wound therapy is a dynamic and powerful tool in the wound care arsenal. It leverages science-backed principles to accelerate healing, manage exudate, and protect the wound environment. When applied correctly, with proper patient selection, education, and nursing oversight, NPWT results in fewer complications, better outcomes, and improved quality of life for patients. As nurses, your role is crucial. From recognizing indications to managing dressing changes and educating caregivers, you are at the forefront of delivering successful therapy.